Hello, everyone. Welcome back to another episode of Testimony Thursdays. I'm your host, Dr. Jazz, and I'm so excited for this episode, you guys. I do have a special guest today, someone that I met in person at the National Association of Black Physical Therapists annual conference. So I have on the shirt. This is from the Synergy Summit 2025. This came in like swag bags. So thank you all for listening. Before we get started, let's go ahead and dive into our scripture, and I will have our guest introduce herself. So our scripture today is from Matthew 18:20. For where two or more, for where two or three gather in my name, there am I with them. So that's one of my favorite scriptures because I feel like when we went to the National Association of Black Physical Therapists conference, it was just an amazing, like, powerful event. And we all got to just be in the presence of greatness and just, amazing people. And I bumped into a lot of believers too. So I thought that was a very cool thing about the event. But yes, y'all know that's one of my favorite scriptures. So I have Dr. Kiaana Howard with me, physical therapist. If you could please introduce yourself, that would be amazing.
Yes, thank you, Dr. Jazz, for having me on today. I'm so happy that we met in Atlanta at the previous National Association of Black Physical Therapists conference. I have to piggyback off of you. The synergy in the atmosphere, it was just so unique. It was nothing that I have experienced before. I've been to a conference before as a presenter, right? But it was nothing like being a participant in the audience and kind of just soaking up all of the energy from all the good people and the good speakers there. So that was awesome. But yes, let me introduce myself. My name is Dr. Kiaana Howard. I am a practicing licensed physical therapist, originally from Nashville, Tennessee, but I have relocated to St. Louis, Missouri with my family. So we are currently here right now. A little bit about me, I practice in outpatient orthopedics, so I have a good background in that setting, a good background in inpatient rehab, and I've also been in academia. I was talking to Jazz a little bit offline about how I am slowly kind of transitioning into more healthcare project management. So that is a new thing on the horizon for me. So still a practicing PT, I still see patients, still in the education sector. So I love health education, whether it be to our students or community members outside of the classroom, and then kind of dipping into this healthcare project management right now. So just happy to be here. Thank you, Jasmine, Dr. Jasmine, for having me today.
Yes, thank you so much for sharing. And I feel the exact same way you feel about like the conference. Like it's something I've never experienced before. Just good vibes, good energy, and people doing things that are like just non-traditional. We met a lot of cool people that are physical therapists, but they're also using their God-given talents in different areas and sectors of healthcare. It's not just, one-on-one patient treatment. So that was very inspiring to me. And just being able to network with people, and get them on the podcast so people can hear about these different testimonies and stories. But yes, thank you for sharing that because I even with me when we were talking offline and stuff about different things we're passionate about and some transitions that are going on, like I'm realizing I do like academia, I do like leadership, all of those things, and I want to implement that more into my career. So even with my current job and current company, I have like a new position where I'm an ambassador for this program we have, and it's basically like just highlighting focusing on patient care and making sure that our clinicians know how to go and talk to people and cultural awareness and making sure that they're getting the support they need from us as a company. So it's not like I'm doing, one-on-one patient treatment with the patient, but this is a whole nother like leadership role. So I'm excited about that. But yes, Dr. Kiaana, I feel like my icebreaker was, what was your favorite part about the conference? And I feel like
Mm,
we kind of hit on that. But
yeah.
you want to talk about maybe like one of your favorite speakers or anything else you want to add about the National Association of Black Physical Therapists conference?
Yeah, I think you were spot on. I think where the profession is going, or maybe where NABPT is kind of merging, like, I guess, our community in the profession, it is utilizing the platform, right? So we have these doctors in front of our name for a reason, right? So not only are we experts in kinetic movement and how to heal the body different ways, but we also have, like you said, God-given talents in other areas. So it's like God has positioned us as a physical therapist, right, to kind of get to the door he needs us to go through. And then we're utilizing our platform to kind of walk through that door. So as you mentioned about, you're a PT, right, working for this company, but then you kind of dibbled into leadership. Jasmine, maybe you were a leader all along, but you just needed that physical therapy platform, right? That doctor in front of your name, those letters behind your name to kind of get to the position where God wanted you to be. And that's kind of where I feel like I am right now. Dipping into like community engagement and then community health education for the community. I've been doing that even since the undergrad. Not necessarily health education, but I've had some kind of involvement with community service since an undergraduate student. And this passion of mine has just kind of followed me from school and into my professional life. And now I'm kind of utilizing my platform, if you will, that God has given me to kind of to go through different doors that probably wouldn't be open if I didn't have this foundation first. So it was just so unique going to that conference to see everybody that's a physical therapist, right? But we're all branching off into different things. Because honestly, I feel like it's going to be bigger than physical therapy in the next few years. It's not just going to be, oh, well, can we do these quad sets? It's like, okay, how can we branch off and help the masses of people? You know what I'm saying? Yeah. So
Oh
that's
my.
where I feel.
Yes, yes. Thank you so much for sharing that. And I received that. I received that definitely, stepping into that leadership role that I've already been preparing for. Um,
Mhm.
but maybe I just needed this title to make sure I can branch off into it. And my favorite part definitely was meeting people that, like how you said, we're all doing different things. And
Mhm.
Dr. Catherine, she was someone who really stood out to me because she talked about how she created this platform and program to monitor women during pregnancy and after pregnancy to monitor their vitals. And the way she broke it down, like she was saying, we all need to know our vitals. We need to take our blood pressure. We need to take our temperature, our weight. Like those are things that we should know. So when something feels off, we can go back to the patterns. So even with me, I was guilty and I wasn't taking my blood pressure. And I do that every day for my patients. So I started
Mhm.
doing that and just making sure I'm working out, eating right. And that was just a seed that she sowed. And now I'm doing that for myself, not only for my patients. But I thought that was really cool because it tells us that we can do it. Like we look at problems every day, but I feel like as physical therapists, we're very solution based. And it takes a special
Mhm.
type of person to want to branch out and to be in that solution and not just, dumping it on somebody else. But you're right. Like the years to come, physical therapy is definitely going to transform. Like we're already talking about being primary care providers,
Mhm.
education, all these different things we can do with our doctorate degree is so important. So my question to you was how did you get started in physical therapy? What made you want to become a physical therapist?
Yeah. I'll give you the short version. So, I was a student athlete all throughout high school and college, and I had an injury in high school, so that kind of introduced me into physical therapy. I knew back then that I wanted to get in healthcare, but I just didn't know what avenue to get into. So, in high school, I sprained my ankle during a meet or something, and I went to this clinic, and I thought, oh, this is a cool profession, because the therapist that I had, she was a former track athlete like myself, so we kind of connected, and maybe that was the piece for me, like how physical therapy is all about relationship building and rapport building and how you connect with your patients in order to improve health outcomes. So we instantly connected on just being an athlete. And then in undergrad, I actually had the opportunity to join this internship, which was directly for, or excuse me, indicated for minority students, right, to kind of get introduced to different fields in physical therapy. So from there is when I saw actual physical therapists that looked like me. Like, girl, I went to a whole clinic, and it was in Memphis, Tennessee. I'll never forget. And those therapists really kind of changed my life to thinking like, this is something I can do. This is attainable, right? This is something that it's an awesome profession. And just seeing practitioners, doctors, right, that look like me, it just solidified my decision altogether.
That's so beautiful because some people don't get that opportunity. So I had
Mhm.
something like that as well at my undergrad. I went to a HBCU, so I was I was around a lot of people that looked like me, and were going into successful careers and had different professors and things that looked like me. But not a lot of people knew about physical therapy and how to get into physical therapy school and all those things. So I did a program too where we learned about the different healthcare professions and respiratory therapy and like just different things that I didn't even know about until after I did the program. But that is so important. And representation is important because people aren't hearing about those things. And right now, I'm actually trying to be an ambassador for PT Moves Me with the APCA. So then other like people from underrepresented communities can know what physical therapy is and how to get started in it. But yeah, I feel like physical therapy is like a very it's just a different field. Like people, I think I rarely hear people saying I want to grow up to be a physical therapist. It may be I want to be a doctor, but
Mhm.
not like a doctor of physical therapy, maybe a medical doctor or a nurse practitioner or a pharmacist, different things like that. But that's a really good program to be involved in. And
Mhm.
I know, when I met you at the conference, you were telling me about the TED talk that you did and you shared the video with me. And you actually, had some research that you highlighted in the TED talk about why representation is important. And I was like, oh my gosh, I didn't even know there were articles out there that discuss that. But I'm glad we do have the evidence that backs that because it's so many different things we can do with that now, and people will want to listen to our voice. So even with me, like with my testimony, I failed out of physical therapy school my first year because my GPA was 2.76 and I needed a 2.80 to remain in the program. So now I'm a part of the advisory panel for the school that I failed out of. And I have a say now about what's going on and how to get more students into the program and how to help with retention. And one big thing that I'm trying to work on now is having an articulation agreement with HBCUs. So then we can get more students that come in that are of people of color, Black people, and they can become physical therapists in a more like just an easy pathway. They do it for other schools. So I'm like, why can't we do it for HBCUs as well? So that's
Mhm.
something that kind of caught my eye when you did the TED talk. I was like, oh, I need to share that with them. But can you talk about how you got to do a TED talk? Like, how did that come about?
Yeah, for sure. And you hit on so many good topics, Jazz. I want to get into them. So how the TED Talk came about. One of my friends at the time, she was a coordinator over the TED Talk Lenox Village, which is it's a suburb outside of Nashville, Tennessee, which is where I'm from originally. And she asked me to do a segment in healthcare. And girl, I didn't even know what I was going to talk about, but I think God just kind of led me to discuss health disparities, and not only health disparities, within our general population, but also in our profession. In the TED Talk, I kind of broke down the demographics by percentage, and Black African American individuals are underrepresented in physical therapy when it comes to the ratio proportion to the general population. So what that means is, so in the population, right, the United States Census, Black and African American represent about 14% of the population, right? And this is if you fill out your census every 10 years. But we're only represented about 5% in physical therapy, right? That is a huge disparity. What really should happen is that it should be more equivocal, right? It should kind of be our profession should be reflective of the general population that we treat. And other demographics I kind of broke down through Hispanic Latino. So in the general population, Hispanic Latino race represents about 19% of our population, but in physical therapy, they're only represented about 4, right? That's also a huge disparity. However, individuals that identify as of Asian ethnicity or Asian descent, they're represented about 5% in our US population, but in PT, right, physical therapy or any other health profession, they're actually overrepresented. So in physical therapy, it's about 11%, right? So you kind of see the disparity there. So one thing that you mentioned, Dr. Jazz, is about a pipeline system. You described a pipeline system to the T, right? So you have this physical therapy program They connect, they partner with other HBCUs to help matriculate African Americans or individuals from diverse backgrounds or underrepresented backgrounds. That is exactly what needs to happen in order for our profession to actually be reflective of the populations that we serve. Another point you hit on earlier was like, when I was younger, we never talked about physical therapy, or this is a profession that we haven't heard of, because really it's not a lot of awareness of physical therapy. So if you think about it, our profession is a luxury, right? You have to have a certain kind of insurance in order to be seen by a PT. For me, I'm speaking for myself, I didn't have that certain kind of insurance, right? It wasn't until I got injured as an athlete that I had to see a physical therapist, right? Or my track career was going to be over for me to be like, okay, I need to, go see a PT. But this wasn't a luxury premium that my parents had growing up. So physical therapy was a profession I've never even seen until I was a 12th grade, senior in high school student. Um, so that's kind of what sums up how I got into the profession. And then what was kind of discussed in the TED Talk is that we do have a health disparity, which is a lack of diversity in our profession today, for sure.
Gosh. Oh my goodness, girl. I can talk to you forever. I mean, this is so good. And thank you for breaking down those demographics for me. Because
Mhm,
I don't have like the knowledge or like the voice to communicate that sometimes to in different rooms that I'm in. But I can give you I can give you two examples of why it's important to have representation. So another thing too, another PT I met at the conference, Dr. Devin. I do want to get her on a podcast, but everyone's so busy, but we're trying to coordinate that. She
mhm,
talked about about the Wells criteria for DVTs and how she basically, found a disparity or a hole in that's not catching the like our melanated people and how we have dark
mhm,
skin. So if we're basing it off of like redness and if they just had surgery, active cancer, immobile, those different things, she talked about how she had a patient that she felt like had blood clots, but
mhm,
everyone in the clinic was like, "No, he's fine. Like it's okay." But he just had an Achilles injury and repaired surgically. And then she was like, "No, like I really think you need to go to the ER." So he went to the ER and he did have blood clots. But
mhm,
it's harder to do that screening and to meet the criteria if you have darker skin because that automatically takes out the redness part. Like there's no other um, thing that they have on the Wells criteria that really targets people of color and people who have darker skin. So that's an important part of representation because if she wasn't there and she wasn't thinking about it, this would never have been a thing. And now she has a whole case study that she wrote and got published. So that's like, that she really saved that person's life. And imagine how many other lives that could have been saved if someone would have caught this earlier with the well screening. And then when I was in clinic too, a couple years ago, I had this patient that was Spanish speaking and pediatrics. The family was Spanish speaking. The child was very young, and just it was a whole lot of things going on with a bunch of medical complexities. So they didn't have a translator. And we would use like our Apple phone, and try to translate, Apple Translate or whatever. And I was like, no, like he's been seen here for over a year before I got there. I was seeing him for a couple of weeks and I was like, okay, no, this is ridiculous. Like we need to have a translator come help us because I don't know what's really going on at home.
mhm.
So then I looked up his insurance and he's on Medicaid and Medicaid covers medical translators if you are in a medical visit. So only thing I did was Google it and then I called them and they said, okay, we'll send out a translator in person to your clinic. Mind you, this is Hawaii. Like it's not a lot of people that are medical translators here. But they sent someone out free of charge every visit. They had a translator. And I'm like, if I'm the only black person that works there. And I'm like, guys, like this is something like, what if this was your child? What if this was you and you were in a whole different country and you couldn't communicate your child's needs to somebody that you're seeing twice a week or once a week? So those things they matter. It's important because you're really saving people's lives by addressing the disparities in demographics. So thank you for touching on
I
that.
agree. No, I agree. You said a few things like what you described, what you did, we call that cultural humility, right? And the healthcare system and healthcare education, as we know, has been flawed for decades. Um, it has mainly been taught on the basis of race-based healthcare, right? So you mentioned earlier about Dr. Devin and how she noted that there were discrepancies, or excuse me, there's kind of a disparity in the Wells criteria because its only standard is for fair skinned white people, right? Well, we don't have fair skin and our skin doesn't turn naturally red. So that automatically gives us a disparity because how can you tell if we do have a blood clot? So where she's coming from is kind of that race conscious, right? Being cognizant of, okay, you know, a more melanated person wouldn't turn red that easily. So what other things can we look at, right? Like let's take a look at this again and kind of you know, revamp or modify the Wells criteria to kind of meet the needs and be inclusive to all skin tones instead of fair skin tone. And as you mentioned with the patient that spoke Mandarin or Chinese, he went an entire year, right, with an iPhone app to communicate with the language barrier, but all you had to do was just contact, you know, the insurance to kind of figure out what was going on. You, in that sense, you use culture humility, and I think what's been happening over decades and decades is we've been kind of taught to only treat what's in front of us and then we just move on to something else and not treat the whole person, right? So not only was that person coming in for low back pain, but let's kind of be cognizant and culturally humble to this person having a language barrier so we can really figure out what's going on. You know, there may be innuendos or there may be unspoken or nonverbal messages that he's sending you guys and you don't know because you don't speak Mandarin and he or she doesn't speak English. So having that interpreter there, right, having that middle person there to kind of bridge the gap of the language barrier and also bridge the gap of the cultural differences that you have, it probably helps and improved his health outcomes for sure.
Yes, because there was so much equipment that he needed. Like he would cry when he came to our appointments, but then we found out like his AFOs were too small and he needed different equipment and all those things. So it was very complex. But thank you for those terms because yes, sometimes I talk about different things and I'm like, I know there's a term behind this, but I don't know exactly what it is. But
Mhm.
yeah, it's important. It's important. And I'm so glad you highlighted that with your research and that TED talk because I know that's going to reach so many other people, and it's amazing that we can do that as doctor of physical therapists and really like utilize our degree and our title. And I feel like this year and the years to come, like we're really stepping out on being calling ourselves doctors. Like I know, like when I first graduated, you know, I wouldn't introduce myself as like a doctor because I know like white coat syndrome and explaining to people like, yes, I'm a physical therapist, but this is a doctorate degree, so this is my profession. But I earned the highest degree in this profession, so I
Mhm.
was like, oh my gosh, are people going to get it? And I recently went to the American Physical Therapy Association leadership congress meeting, and they had a speaker there. I forgot her name, but she talked about how we do like a disservice when we don't introduce ourselves as like doctors and talk about our degrees because she was like, well, okay, if you're concerned about them having white coat syndrome, you can just say, hi, like I'm Dr. Jasmine. I'm going to be a physical therapist today, but you can call me Jasmine. And then you make it more personal. So I was
Mhm.
like, oh my gosh, that's a good tip. Like I'm going to start doing that. But because one of the ladies who I work for, she's another woman of color. And when she meets her patients, she that's how she introduces herself. She's like, "Hi, I'm Dr. So and so. This is Dr. Jazz." And I was like, "Oh my gosh!" Like I never had someone, introduce himself like that. But
Mhm.
yeah, we're doing some really good things in the profession and shaking things up, and saving lives one day at a time.
Absolutely.
Oh my But Dr. Kiana, I'm not going to take too much more of your time. I do end every episode talking about a test that we're going through that's going to lead to a testimony, or a test that we went through that's going to lead to a testimony. So if you could touch on that, it'd be great.
Ooh, okay. I think a test that I have been through is just stepping out on faith. Um, Stepping out on faith in the sense of when I created that TED Talk, Dr. Jazz, it was 1 year after I graduated from PT school. 1 year. Exactly. So I was fresh. And I think stepping out on faith to me was thinking, oh, I'm inexperienced. I'm a novice at this profession. I don't have anything to talk about. But what was so amazing is that God showed me that I do have a lot to talk about. And the things that we just talked about, Dr. Jazz, and the things that I talked about on the TED Talk are not being talked about enough. So stepping out on faith is kind of remembering that even if you are young, or inexperienced, if you will, you don't have the number of years behind you. That shouldn't stop you from doing what God has called you to do. So I'm just very blessed. To continue to be stepping out in that sector. Even when I stepped into academia, I hadn't been out of PT school for a long time before, being an assistant professor at a university. And even transitioning into this field with, going into more community care and project management, this is something I'm stepping out on faith in. So I would just encourage anyone, if you have that idea that you've been sitting on, you have that itch, that urge, that's God trying to tell you to move, and just listen to that urge that he's calling you to do, and just, perform it.
Hi, that is a word. Oh my goodness. Thank you, thank you. Because people need to hear that. We're always waiting on,
Mhm.
oh, well, I need to get this. I need to do this residency. I need to do this and that. It's like we learned so much in physical therapy school
Mhm.
that you can go out and be a speaker at a conference as much as we learned things, as much research we had to do in PT school. Like these are things that people need to hear, and we're never going to be ready. It's always going to be something that we're learning. It's always going to be something that we're doing. So we need to start now. And I put this quote in my book too. It talks about how is never more important than why. So why
Mm.
are we doing what are we doing? We're being obedient to God, we're helping people, we're serving others. And you may have this really big idea and vision, and you're like, how am I going to do it? And then you start to get down on yourself because you're like, man, I got to have money to do this. Then I got to get that. Then I got to get a new phone, a new computer, a new job, a new position. And you're thinking about the how, you're not thinking about the why and focusing on that part. Because if God gave you that dream, He's going to equip you to be able to pull it through and finish
Mhm.
it. So yeah, we get caught up in the wrong things, and then we start to tell ourselves no, and we stop the miracle before it happens. That's something I learned from Dr. Kat's podcast. I was like, wow, we prevent the miracle from happening because we don't follow through with the why. So
Yeah.
thank you so much, Dr. Kiaana. If you want people to be able to reach you and follow you on social media or network or LinkedIn or anything, could you provide some of those resources?
Yes. So on LinkedIn, you see my name here. You just type that in, just like that. Kiaana Howard, PT DPT. That's how you can find me on LinkedIn. I'm also on Instagram. So the @ Dr. period Kiaana H. And that you'll find me there on Instagram too.
Awesome. Awesome. Thank you so much. I really could talk to you all day. I mean, I am a big nerd when it comes to things like this and, providing action and to being able to give back to our communities and help people that, may not be aware of physical therapy. So thank you all for joining. This was another episode of Testimony Thursdays. Follow us on Instagram at Testimony Thursdays and TikTok at Testimony Thursdays, as well as YouTube. Please like, comment, subscribe, share, and we will see you all next week.
Yeah. Thank you again.